One alive.
Hi everybody, Ian here from Provisions Health in Toronto, Ohio. I'm here with Neil Nichols and Jesse Nichols from Tell Me Your Business.
From Full Body Balance here in West Virginia, right across the bridge there. Thank you for joining us, and today we're excited. We're actually expecting some extra guests. They're a little bit behind, but we're going to be talking today all around what we had a great weekend coming off. We actually had a Common Sense convention where the owners came in. The East Coast Convention of Common Sense came in Pittsburgh, Pennsylvania, and it was an amazing weekend. Learned a lot, learned about the new concepts of what's out there in health. Ian, your thoughts on the convention this weekend?
The convention was good because you get to meet other people who are using products and how they're using the products and the benefits and the signs and symptoms that they're using them for. Mm-hmm. And I think that piece of it, the testimonials also were amazing to watch as a clinician because, you know, it's not very often that you have a group of people that gathers and says, this is what this did for me, and it's not a prescription.
Yeah.
So to me, that was nice because, you know, there are so many people who can't take certain medicines or don't want to for whatever reason. So there are awesome alternatives out there for basically everything. I think the most exciting thing I learned this weekend was I didn't realize you guys had like Common Sense has makeup and beauty type.
There's
pet things.
Yeah, see, you know, and a lot of people when they get overwhelmed because if we showed there's probably over 75 plus products, and I know they're going to come out with more this year, that we have that almost every aspect of your life that we have a product naturally for that people absolutely love. And they don't, once you start using it, it's like, wow, it's one of the best that they've ever used because that's what they do. Another side of this is where what I love about is the culture that comes with it.
Yes.
The actual family structure. You know, yes, Common Sense is a business. We have amazing products, but Joe Mellon and Richard O'Brien, one of the main things that they want to bring forth is the culture of helping each other as a community and as a family and growing. And we saw that in Pittsburgh, and I think everybody else that was there was just like, wow. So
I think one of the most amazing things, not most, but surprising, I should say, is we started off with the Pledge of Allegiance and the national anthem.
Yeah.
And then we prayed. And I'm like, oh, like traditional American Christian values. And it's okay to do that. And no one's upset about it. And it was just nice to see that this is who we are. This is what we believe. And we don't really care what anyone else thinks about it. We are who we are.
And it's the blending of that. It's the understanding of all the cultures coming together. Because to be the world leader in helping people help themselves, it's having a heart. That help be the world leader, helping people help themselves. Is to have a heart of every man. That we have an opportunity here to be the best of what we should be, because that's why we're here on earth. You know, I looked at, you know, everybody was there, and people would think we always have this that we're not good enough. And I go back, I saw this saying the other day that says, do you know how many millions of possibilities have to happen for you to exist? From your ancestors, your grandfather, your two sides of your grandfather, one saved the other in your lineage.
Sure. For
her to be here, okay, in World War II, one was on the boat, one was in the water. So yes, we deserve the best. How did we get there? We have some common sense and get back to our basic values of who we are. So the beauty of having this is to have the best of all worlds and have the opportunity where you have a family to help you do that, to be the best.
Absolutely.
So today what we're going to talk about is last week we talked about men's balance. Did you look at the views? How did that
The last I looked, we had, I want to say like 2,900 views, and that was several days ago. I have not looked recently.
Well,
Shame on me.
The cool thing about it is we're getting so many feedback from our lives. We're getting some people who are starting to reach out. Today I posted things, people were reaching out naturally, like, hey, you know, what's going on here? Because I think now we're getting a voice. Let's start to get a little bit of voice in the community.
Yes.
But your perspective on this weekend, Jussie?
On this weekend, I think just to back up what you guys said is the people, the culture. I love going to the Common Sense conventions because it's like going to a family reunion of people that
You've never met, but your family's crazy.
Yes, yeah. You get so many hugs, so many people saying, hey, if you need anything, I'm here, let's work, let's build together, I want to see your dreams come true. And it's like, where do you get a whole giant room full of people that are cheering you on? So that's what makes it special to me.
Mm-hmm.
Yeah.
And all around everyone that joins that culture. But I wanted to get to you your perspective on that. But this last week we talked about men's balance. This week we're going to be talking about women's balance.
Mm-hmm.
And a little bit about that as far as what's the ingredients, why do you think every woman should have this in their lineup as far as maintenance of health, and why it's good for some and why it's not. And we're going to have testimonies, and I'm sure we're going to have some other people come in talking about on the women's side of things, and that's the beauty. We'll talk about women's balance.
Absolutely. So, like Neil said, who is this for? Women. You know, last week I said, we have to define a woman for this. So last week we said a man has a penis. This week we're saying a woman has a vagina. So that is who this is for. Okay, that's just me being clinical. I'm not trying to be controversial, but that's who this is for. So what types of things might this benefit with? PMS would be one. Emotional regularity around your hormones, around your cycle. Post-menopausal issues. This can help with issues like recurrent urinary tract infections. There's just so many different things, and again, that's one of the things that I have found as a clinician with Common Sense is when they do something, they do it. It's not a product that is just designed for one thing. It is a product designed for the entire woman and everything that a woman may need or may experience. There are a couple contraindications from a medical standpoint that I would caution. The one is it does have mushrooms as ingredients, so if you have a mushroom allergy, I would not recommend. The other that I would not recommend for is anyone with estrogen feeding or progesterone type feeding cancers. So for example, Rhonda does not and cannot take this because her breast cancer is progesterone and estrogen positive. So we wouldn't want to give her anything to fuel her cancer. But as far as taking it, if you do not have cancer, there is not an increased risk for that happening. It's just if you have that diagnosis, you should not take it. But for everyone else, I can find no contraindication or reason not to take it. I just marvel over and over at the intent of the product is never for just one thing. It is always multifaceted.
There's a cross barrier.
Which I think is interesting. So I just wanted to talk about a couple, and when I say a couple, there are several. And I'm not going to talk about all of them in depth. I'm just going to hit on the big ones. So this has black cohosh in it, which is great for menopause, especially hot flashes. The other one here is DIM, which I'm not going to say the word because I screw it up every time. But this is what influences estrogen metabolism. And I think my wife is walking in the door.
Hi!
Hello.
So Rhonda made it back from Columbus, so she just walked in the door. Say hi.
Hi.
Hi! Welcome!
Hi.
So glad to have you.
DIM also helps with PMS symptoms, hormone balance. Oh, that's the other thing. This would be great for anyone who has hypothyroidism or thyroid functions because a lot of these things help balance and regulate the thyroid. So just keep that in mind. This also has ashwagandha and maca root. Does help with hormone balance. It shows some effects on menopausal symptoms in smaller studies. Cranberry extract. This is the one that's going to help with the UTI prevention. It has calcium for essential bone health. It has IP6, which has antioxidant properties and anti-cancer effects. So remember how I said safe to take if you don't have a hormone-feeding cancer? This is why, because you can get the benefit from the estrogenic ingredients, but then you're getting cancer prevention from others. This has L-glutathione and alpha-lipoic acid. Both are antioxidants with anti-inflammatory properties. Think about what happens when you get old. As you old, you get aches and pains, and who to think that a vitamin could, or a hormone supplement balance could help with all of those things is just amazing.
It is, you think about it, it's just a cross-reference of it, almost every aspect of the body it helps with, and not just hormonal. I know with your kidney functions and so forth, you haven't had any issues.
No.
You haven't had a UTI since using it over 3.5 years using these products.
The other thing that I thought was interesting, because we talked about DIM earlier and how it helps with the PMS type symptoms. The other thing that DIM helps with is hormone-related acne. So if you're a woman who has breakouts in and around the time of your cycle, your period, this helps with all of that too. And the list, I can go on and on and on and on and on. I guess, but my overall point is, it's just an overall well thought out product. Other than the two contraindications I had mentioned from hormone-related type cancers and mushroom allergies, it's a win, man. And I see so many women come to my clinic and they're like, I need hormone replacement, I need to go on estrogen, I need to do this, and I know the guidelines for hormone replacement have recently just changed. And so they are promoting estrogen replacement therapy in women. Reason being is when your estrogen becomes low at a certain age, that can increase your risk of cardiac death, which takes years off your life. But there is still a risk of developing breast cancer when you go on hormone replacement therapy. Is it less than the cardiac risk? Yes. But when you're a postmenopausal woman taking hormone replacement therapy, you're already at a higher risk for hormone-feeding breast cancers, and you're taking a hormone that could be potentially feeding something. You do not have to worry about that with this, and you get the benefit. I mean, the labs don't lie. You can check hormone levels before, and then you can have them be on these products, and then check the hormone levels after a couple months on the products, and they're improved. I'm like, so clearly it does what it says it does, and that you can't argue with that.
I'm going to go from the woman perspective on it. Before starting this, and I remember when we got it around the same time, the women's and the men's balance, we ordered at the same time. And around that, I mean, you can take it from there. What's changed?
So the first product I started on was Plain Sense. Loved that, so we decided, okay, let's add the men and women's balance. So when I got the women's balance, it was probably 3 months after using the Plain Sense. And I would say the Plain Sense helped tremendously with like anxious thoughts, dealing with overwhelming just like sadness over things that, had happened previously. The Plain Sense really helped with that. But I was still experiencing that, monthly women time where I would have the Plain Sense wasn't enough to help with.
So like you're saying you might have had some PMS symptoms?
Yeah, just maybe.
I'll just say it.
Yeah.
So you were getting bitchy around the time of the period.
Clinically.
That is my clinical diagnosis.
Clinically.
So just like I like the men's balance, Neil likes the women's balance.
What's funny about this is that, being married now, you can tell when that cycle is coming. You'd be like, yeah, it's coming. we didn't know. It's like we were
That
out.
is one thing. I don't know.
We were out. And you were like, oh, and I was like, okay, great.
At our house, we used to say that Rhonda was firing up the bitch cycle, and it sounded like this. I'm like, so.
Well,
It's true.
Well, what's so funny is that I would know when using this product. Like there is no pre leading up to it that
Yes.
there is an issue anymore.
I have no
so.
pain leading up to it. I have nothing.
GI complications,
Nothing. Like,
mental fog.
I have
Yeah,
nothing
yeah.
leading up to it. I will have 1, maybe 2 days of cramping. That is a lot milder than it used to be. And
Which is normal.
the length of that cycle is decreased by 3 days. Okay,
Which an
so-
average is 3 to 5. That's
and I'm
that-
in that average
and that's
now.
okay.
I was beyond that. I'm
Yeah.
in
Yeah.
the average now.
Yeah, I remember. Absolutely.
It's great.
Now, did it? I'm a girl, and I came from Women's Health, so I'm just going to ask: did it change the flow level at all? And that's just
I
actually
don't-
curious.
I don't. For me, no. For me, I'm pretty.
It
much
might
the
not.
same.
It might not.
Yeah.
I'm just wondering.
But it's a shorter time period.
Sure. So we got it over with in shorter
Yeah.
time, which is great
Yes.
for everybody. Yeah.
Yes.
I used to dread it because I would be at least a week, and that's a whole week, over a week of your month.
I don't know about you, but
Yeah.
when I had this problem before I tore down the hotel and put in a playground, which is why one of the reasons I don't take it. But anyway,
There was a reason you weren't allowed to do these shows. Because
I told you all I wasn't mature enough for this. I don't even remember what my thought was. Go ahead. Oh, a lot of women talked about having a lot of my coworkers and everything would talk about having 10 normal days in a month where they felt sane
Yeah.
and physically functional. And has this helped get more of those days in a month back?
Absolutely.
That's fantastic.
Yeah. Absolutely.
It's been.
And you just take it every day.
I take it every day. The serving suggested is 3 capsules. I'll show you. This is mine, so I can put them. They're purple.
They're they're purple and the men are
Purple.
green.
And for the record,
That's
the reason they are purple is because it is a beet capsule.
Capsule.
So the capsule itself is all natural with no garbage in it.
No dyes. No,
Yeah.
I mean nothing beyond the.
Listen, when we leave, it's so funny. When we actually leave the house, packed for Aslan, and then for the adults, there is brain sets, there's women's balance, there's booze, there's all the different things that we pack and leave. And then, so sometimes we'd be out, we open in the car or whatever, like, oh, great, there's women's balance. I forgot to take it. It's there already because that's how significant it makes a difference in our lives using these products.
Yeah.
And I will clarify something Neil said because to me it sounded like he said booze. He said boost.
Boost. No, that's not
Boost.
boost.
There may be booze in there.
Right. No, which is the
No.
boost and the Zen sense what we talked about a couple of weeks ago.
I will add, though, it does say a second dose can also be taken after dinner if desired. I do that on those couple
Rough days.
days that I am. Yeah, I take the second dose.
I was just gonna ask what happens if you only take it a certain time.
Yeah, I take it every day, and then the second dose on 3 to 5 days a month.
Sure.
So the other thing I want to talk about in conjugation with this product is another topic that, as a country, I don't feel like we talk about enough. Last week when we were talking about men, men have erectile dysfunction when they're having issues and unable to perform sexually. Women's equipment and anatomy is a little bit different in that sense, however, but women do and can have what's called female sexual arousal disorder, and no one ever wants to talk about it because everyone just thinks well, That's
Because-
not a thing for them.
Well, Hollywood has made it out like women never have a libido. I personally feel like Hollywood has made it out to married women, especially, like never have a libido, and that's not true.
Mhm. And so this is something that can help with that. So what is female sexual arousal disorder? It is literally what it sounds like. It's, I don't feel like it. I don't get turned on. I don't have the urge to have sex. Or you might have the urge to have sex, but it doesn't feel good like it used to. Or maybe you're perimenopausal or postmenopausal, and it's like dry sandpaper down there. These are things that happen naturally. Listen, we have to talk about them. You know what I mean? Because if we don't talk about them, you as the viewer or you as the patient or the client sit at home and have these problems and think it's too intimate and we don't discuss it. We're still offering real life solutions for these problems, and this is it in an all-natural product that can help from your mental health, your physical health, your spiritual health, your sexual health, and women's balance. Again, like when I tell you they have thought about all the pieces, because let's be honest, the products work, okay? From a clinical standpoint, I've used them. I have several patients using them, and I have not had one of them say that they dislike it, do not like it, don't want to take it. But I don't know what I was saying. Help me. It's the end of the day. It's hard.
Sorry, I'm sorry. I know. I immediately went till I'm like, we have one person that didn't care for the motivate, and that was it.
Yeah.
And I mean, as far
Motivate made her tired.
as which I mean, whatever. I'm impressed because out of all the products that people have tried, and everybody's loving everything minus that one person, and it's not even that she didn't like it. It was just like, here, I don't need it. You know what I mean? I'm like, okay, whatever.
When I had the store, and out of every product that I gave for Common Sense of people coming back, they either bought it in bulk or they bought it in singles. They came back because they felt the effects right away. One of the beauties I love about men and women's balance is that since using this, our relationship is different. It's like we're young again. We don't. I remember before, especially after Aslan being born, the first year after, mom and dad is tired, okay, and it was like
Profoundly tired, like a whole new level of tired. That's a different level of tired.
We didn't have the energy. We didn't have. It was like, see you in my dreams, there, buddy. For weeks or whatever, because at the end of the day, you didn't have the energy, the mental energy. But since using these products, I'm telling you, we don't leave our house without these products, because we see the difference in our lives using it, because it's keeping the youth all around.
I remember what I was going to say. Time out.
Go ahead.
You are right. My point that I was making is these products work. They could literally take and make 5 or 6 separate products out of this women's balance to work for different things for women.
And make you buy all of them.
And make you buy all of them. And they could do that. And there are other companies out there that do that. If you don't believe me, go on Amazon. They might be $20, but when you add up all the products that you have to buy to make what this is, you're paying 3 times as what this is.
Yeah.
And then if you just buy this,
And they won't work as well.
And they won't work as well.
The micronutrition.
To the micronutrition, I want to say to this because I had someone ask me in office today. They're like, "Well, really, what is it?" And the best way that I can describe micronutrition is the product is broken down into the body's usable form already, so that your body doesn't have to do that. Does that make sense? So just like when you take medication, for example, let's say you take a 100 milligram tablet of something. Your body may only need 25 milligrams of that, so it has to be digested and broken down, and then if your body works correctly, you may get the 25 milligram dose you're supposed to get. You may not. You can have genetic abnormalities, things like that. But when you're looking at products that are already broken down into their most basic, usable, natural form, you swallow it, you ingest it, your stomach acid breaks open the capsule, and absorption starts immediately, which is why you feel the effects much sooner than with other products. Which is also why you pay more money, but at the same time, you're paying for quality and multiple benefits. And I don't know about you guys, but as I have gotten older, and I'm not that old, I'm 40, but I felt like when I was in my teens and 20s, I just wanted stuff. It didn't matter if it was quality stuff or not, I just wanted it. Now I'm more about, I'd rather have less, but what I do have, I want to be quality.
Yeah.
Well, you're in a different phase of development at that point. You know, in your 20s, you're wanting to be your own person, and now you've been your own person, and now you want quality.
That's something my grandmother instilled on me, was crazy, the quality of things.
Absolutely.
And I think you have said that too, she was just someone who, if she was going to buy it, she wanted the best quality.
That was one of my favorite qualities about her, was her commitment to quality.
Yeah.
So she would be proud of us here. I think she would have been really
absolutely.
pleased. And this stuff would have probably been helpful to her.
I should have been our top customer.
She would have. Yeah, she would have. She really would have.
I have to say, there were things that I knew I was going to talk about that I already talked about. But listening to you describe all of these ingredients, I'm like, well, I don't get the acne on my face that I used to get. Like, there's some other things in here that I'm like, oh, wow, I didn't even remember that was happening because it just completely went away.
So tell them a little bit about, briefly, if you don't mind, your kidney issue and why you take the cranberry that is in this and how that is beneficial to you.
Yeah, so I spoke a little bit about that with, I believe it was the Boost Sand Sense episode, because it has the cranberry extract in it as well. So I take both of these for that and among other things. But when I was probably about 6-7 years ago, I had a kidney stone in my right kidney that was attached to the wall of the kidney. So by the time it was found, there was a lot of just damage to the kidney. So it's just all scar tissue essentially. So it
didn't really work.
Yeah, it doesn't work. It's like 4% when they tested it. So I take the cranberry extract, but from that damage, it would usually ache and just hurt at the end of the day. If I've done like some hiking or basketball or anything where I'm moving around a lot, since adding the Women's Balance and the Boost Sand Sense, I no longer experience that pain at all. Which it was, I mean, you can attest to it. It was like almost daily.
But also, we haven't experienced anything.
I haven't had any kidney stones, which I have family history. I have history of getting kidney stones just periodically. I haven't had any.
It's been
no
over 3 years.
UTIs. Yeah.
Well, that's the other thing. It's funny you said about kidney stones. I'm glad you said it. A lot of these things happen. You have different kinds of kidney stones that form. Some of them are oxalate, some of them are calcium, some of them are different substances. However, when women have hormone imbalance, they have a higher propensity to develop kidney stones. Because when your hormones are out of whack, your calcium becomes out of whack, oxalate becomes out of whack. So, I mean, I'm going to go out on a limb and say that if you regulate the hormones, and we know that hormones can contribute to kidney stones, that if this product helps regulate your hormones, then common sense tells this clinician that then we are helping prevent kidney stones also. I'm just saying.
I think you could take that down so many different avenues.
You absolutely
You know what I mean?
And-
That's the part that I love. The
Any
complexity.
questions out there?
I haven't seen any.
Okay.
We've been fluctuating on people watching and everything,
Okay.
but yeah.
Do
we want to talk? Did you guys already talk about our basket thing?
No, we haven't.
we didn't.
Because we should probably
So,
talk about that.
One thing before we do, I know something just recently happened with you taking some products for the last. You were taking a prescribed medication for the last one.
Oh, you can give that testimony here like you did at the conference.
Yes,
Just do it in front of
let's do it in front of
Okay.
what happened recently.
If it makes you
when
feel
comes
better,
to
only
that.
one person's watching. I'm sorry, 2 people are watching right now.
Yeah, go
Which
ahead.
thank you for being here, by the
Okay.
way.
Yeah.
Yeah, so thanks to help from Ian, I came to him and did the visit that they're always talking about. You can come in, was it $99
Yep.
Yeah.
to come in? I did that. I came in, and I've been on a medication for high blood pressure for the past like
Almost 5 years. It was
Almost.
Well, you got
It was
put on
right
it during
after
pregnancy,
Aslan.
right?
Yeah.
Yes.
Because of your pregnancy, and then they didn't really address it afterward, and it just
Yes.
kind of got left, and then you've just continued.
And she did.
Essentially,
and,
yes.
she had asked her other provider, like, oh no, you have to be on this for life. You have to be on this for
Yes.
life. And I'm just kind of, my brow kind of raised. I'm like,
Why?
but why?
Yeah, and I know that's crucial to only one kidney. I have to monitor that and make sure that I'm not experiencing any high blood pressure. But with the help of Ian and muscadine, I am now 2.5 weeks off of my blood pressure medication, and I'm taking 6 muscadine pills a day.
And I have to say to Anne, because this is the part that just tickles me from the inside out. Her blood pressure is lower on the natural
Yes.
supplement than it was on the prescription medication.
That's the part that I'm like,
Look,
So-
and we haven't talked about this yet, but we have a product called Hydrolite. I use that every morning as well. And I definitely, I feel alive when I take it in the morning. You know, you wake up and you just feel like a drained sponge. Does anybody else wake up and just feel like dehydrated?
Never. Never, ever.
No?
I spring from my bread with great zeal.
I feel like
Every
dehydrated.
single
That
day.
is a lie.
Like,
That is a
I
lie.
take it, and it's just like, within minutes of taking it, I feel great.
I would get.
We'll have to do samples and
I would
I
get
wanted,
a muscle
yeah.
spasm. Okay, I'll be in the middle of a muscle spasm or something. I'm working out, and I'm like,
Jesse, go get some Hydrolite.
Hydrolite, and I would take the Hydrolite, and I'm telling you, that product, you would feel your muscle just go. It's like the weirdest feeling ever, where you're just like, oh my gosh, this is happening. I'm good now. I'm good. But what I want to get with is, how do you feel now overall? Because I remember a couple days once you stopped doing it. It's about a weekend. You were like, man,
I feel great.
you feel
I feel
different.
good.
I was gonna
I
say,
feel-
the 4 to 5 days afterward, you were talking about how you felt different,
Yeah.
and let's not getting off medication can feel different, and that's the part where people get real weird, and they're like, oh my gosh, I don't like how I feel, so I started taking it again, and letting your body heal itself might take a couple days, and then you felt better.
I did, yeah. Initially, I wasn't sleeping for 3-4 days after that stopped. Not that I was experiencing pain or anything. I was just awake. I just couldn't sleep. I would just lay there. I'm like, okay, you can go to sleep.
Well, one
now.
of the medicine you were on, particularly for blood pressure, is one that's known to make you sleepy and drowsy. So when you come off of that, you tend to be more awake.
Yeah. I did have a headache, which you warned me. You
I
said
sure
you
did.
may have a headache or a migraine coming. I did. It was like one solid day, and then I was fine. But now I feel things more.
Not muted.
Yes. Yes, I feel things more, and I feel my body respond to things more.
Like you're not held back by the medication.
Yes. Yes, I do. I do.
Which the medication is supposed to do that, and when you needed it during pregnancy, that's exactly what you and Aslan
Yeah,
needed.
absolutely.
And that was great. And
Absolutely.
yeah, and then, but
It's
now,
nothing against- yeah,
but Western
it's-
medicine left you in the dust, as it tends to after pregnancy, and it was just like, well, now you're stuck, bye, sucker, and it doesn't have to be that way.
I love it.
I'm grateful for the whole experience, and I feel good. Thank you.
No.
All right.
No, really.
All it
So our
takes
basket.
All it
Yes.
takes is someone listening.
So our basket, the prize is, we have a $300 gift prize. You saw
Yes.
the pictures.
I've been calling
Okay.
it the au naturel.
It's an all natural that we thought a lot about this basket. We have negative ion bands in there. We have
All kinds of stuff.
all kinds,
Wellness
every
stuff.
Soap,
wellness
crystals,
soap,
CS
crystals,
samples.
everything.
Everything.
you
I'm
can
kind of
think
frustrated that I can't win it. Like that was my initial reaction. Like when you sent the pictures, I'm like, I'm kind of pissed that I can't win it, but that's fair.
You
And
saw
then
the
it
rules.
also
Go ahead.
includes, so it's a basket full of goodies,
Mhm.
and then it also includes.
It's going to be, you get a gift certificate for one visit here with us at Provisions Health, which what I like to tell people about that is you get an hour with me God help you. But it is an hour with me to talk about anything you want to talk about. If you want medication education, if you want education on coming off of medication, anything. If you want an exam, if you've got an earache, if you need whatever. But if you want to trap a provider for an hour and ask them anything you want or examine anything you want, that's what I'm offering you. And how often do you get an hour of a provider's time to ask and do whatever you think needs done?
For free.
So, question: if the person doesn't live in the area, because obviously we're on Facebook, people can be anywhere. Can that be done like over the phone, Zoom, something along those lines?
As long as I'm not treating them. Does that make sense?
Yes.
Yeah, if it's a consultation,
Yes.
it can be telehealth, absolutely.
Yes,
Yeah.
but it can absolutely be telehealth. We can talk about anything you want to talk about. If you need medications or prescriptions, I'm licensed in Ohio, so therefore treatment is not able to happen. But I can certainly have conversations about, if you want to come off, for example, like a blood pressure medication, I would recommend this maybe should be how you should wean, and these maybe should be products you look at.
Yeah, this yes.
Things like that. But I just love to get people in there for an hour, and we talk about everything. Some people get freaked out because I want to know about their views on life and religion, and why is that important? Because I'm treating a human being individually and not generally.
And not a
That makes
protocol.
sense. Yeah, I'm not following protocol. You know what I mean? If
It was the most in-depth visit I have ever
She came
experienced
home
in a
and said
great
that.
way.
Yeah, she
In a
she
great
said
way
that.
because
She
you
was
felt
like,
seen and
Thank you. Yay.
Yeah.
well, when I did my VA evaluation, I was just like, I wasn't sure if I was being evaluated, or I learned more about my health, my history of my health, going through talking to Ian, because that was it. He literally went back, because that's what it takes. It's a whole human aspect of what makes that person, not that whole metabolic, physiologic, everything about the person makes that a whole. You're going to talk about the rules for the contest.
Yes, there are very few. Attend live sessions on 121 and 128. One entry for comments. So if people were commenting during our thing here, they get an entry. If you share our video, you get 5 entries. And then there's 10 points for testimonies, which I'm assuming would be on there.
Yes.
So if you comment anything, you say, hi, I'm here, you get a point for showing up. You get a point for saying hi. If you share it on your Facebook, you get 5 entries. And if you have taken the products, tried the products, and you like them, and if you have any opinion, preferably the positive ones.
I'll take
all.
You know what? I even take the negative ones because you know what? That's how I learn.
Yeah.
If you look at this office and how it's set up, it's very homey. And that was something that we had picked up from our veterans and places we had gone and worked, was the veterans were very upset that it was clinical or dirty or dingy.
It made them uncomfortable.
It made them very uncomfortable. So we try to be very homey.
Yeah. So yes, any testimonial would be great, even if it's not good. But there aren't really a lot of bad ones out there that I have heard anyway. So 10 points for testimonials, and the person with the most points wins, like it should be. And winner will be announced live on my birthday,
Which is
February 4th.
February 4th. So you hear the rules. February 4th, actually, my
So someone else gets a gift on my
so
birthday.
You're an Aquarius also.
Oh, very much. We both.
So I'm an Aquarius also.
I'm surrounded by Aquarius.
You are.
Yeah,
That's why we're all awesome.
Mine is a few days before that, so yeah, the 30th.
Oh, okay.
My father was Aquarius, so lots of Aquarius and Capricorns in our family. But there it is, guys. Another great episode talking about this. A recap of everything. Men and women's balance. Who, as a woman, who and what age takes this product?
I would say women's balance. You could start at puberty. I would.
For biological females.
We have already addressed.
I missed that part. Sorry. Okay.
Yeah.
Very first thing I.
Okay. Good. Okay. We're recapping. It's okay.
Recap.
Yeah.
I would say starting in and around the age of puberty, and the reason I would say that is because a lot of these things are estrogenic, and you would not want to put a child into early puberty. But once that has started, I think you would be more than sufficient to start there, and you can take it from that point forward.
I think this would have been great in puberty, personally.
I can't see a reason why. One of the beauty
All the time.
all the time, and that's where I have in our center at the mall, we have kids from 16 all the way up. I have women in their 80s and 85 taking this product, whether it was pre or post or trying to develop other cells between the contact of two human beings. If they were trying to do that, they were on this product. I encourage that, especially between couples, men and women's balance. It makes a huge difference in our lives.
It does.
I remember you asked about it, and I said, hey, every person that has come to me and said, hey, they're like, okay, Neil, where do I start? And I said, well, you have to start with the brain. Okay, if you use cell phones, you wear a band. If you are a man, you try men's balance. You try, and we particularly we didn't just try it all so we didn't see the difference.
Sure.
We literally took some time, experienced it, documented, and went on, and these are the products that we will never go without for the rest of our lives because it makes such a difference across the board.
I have two more things.
Sure.
And I will promise I'll be quiet because you were talking about puberty and then it spawned into my head something that I need to say. How many times, and you can speak to this as the women's health person, did we put young women on birth control because they're having PMS symptoms?
I don't know another option that I've heard offered.
And so the reason I mentioned that is, yes, it does. First of all, birth control tricks your body into thinking that you're pregnant, which is why you cannot get pregnant. But if you didn't know that, yay, that's something you learned today. The second thing is we are giving you hormones. So those hormones, estrogen, progesterone, fluctuating and things like that, still increase your risk for cancer, still increase your risk for blood clots, and cause all kinds of different issues for young women. So if you could take that risk away, I know in my practice, the first thing out of my mouth is going to be, why don't we start with a natural supplement before we start down this road of hormone therapy?
Yeah.
I met a lot of women over
Now,
the
is it
course
going to
of
prevent
years.
pregnancy? No.
I was just going to say, I met a lot of women
This is going to promote fertility.
Yes.
who, yeah.
If we're taking it for birth control, this is not that.
Yeah, I was just going to say, let's clarify.
I can say at that part, we love each other's supplements
Yes.
and the cross-reference of that.
Yeah.
And so the last thing I think I wanted to do, we talked about the basket, is I wanted to give you two, and you, Rhonda, an opportunity to say something about why you're doing what you're doing. Because I feel like, as this is what, week 9, I think, that we have done this, they see us as personalities, but they really don't know Ian, Rhonda, Jesse, and Neil, So why are you doing what you're doing? It doesn't have to be long.
I don't,
Preferably not.
I don't see another option in health that's the broad spans for the entire family. And be honest with you, on that side of it, as a 52-year-old male that should be on actual prescribed, this is what I'm on, and I feel better. I am feeling it. I don't feel like I'm oxidizing.
He has the lab values to back it up.
Yeah,
So it's not-
absolutely. Inside and out, metaphysically, just everything across the board. I feel and look different, and I can compare that from 4 years, 3 years, whatever till now. But overall, I think every human being has the right to have something naturally that helps, because we don't have that option. What if I didn't meet Gio that literally came to me as a friend and said, Neil, I have something, we wouldn't be here right now.
Sure.
So why I'm doing this is to pass that on and to be able to give people options. And that's my answer.
Yeah, common sense has changed a lot in my life, in my health. My freedom, making new friends, traveling, seeing places I've never been. So since I've started doing it, things have gotten better on all aspects of my life. So I figured, why not keep doing it? And same with coming here and doing these shows with you guys. Things are, things are great. We've got new friends that we're growing with and meeting new people, and it's just
Having Sunday dinners and doing all
having
kinds of
Sunday
stuff.
dinners. And,
How about you, Rhonda? And it can be while you're doing anything, nurse practitioner, common sense, all of it.
I became a nurse practitioner because I felt like to be honest with you, because I was watching things and I didn't like it and I wanted to be in charge of it instead of the person doing it.
I understand.
And so when I got to that point in my life, you were there with me. I had been fussing on nutrition-based wellness for about a decade. And I would always push we have to take vitamin D because of this, or we have to eat onions because of micronutrients and blah, blah, blah. And when this rolled into my life, I vetted it to my standard, and
Which is incredible.
which is quite rigorous, including my own personal trials of the products. And I am wanting to share it with everybody to the point of being an obnoxious salesperson, because I want to be like, even if I don't, and that's my thing is, just buy it or just try it and buy it, even if it's not for me, so that you get the benefit of it.
Yeah.
That's how I know that this is not about anything other than the health and wellness of everybody that I encounter, is because I don't care if you get it from us, just get it. If you choose to get it from us, that's fantastic, and we can grow together. After going to conference, I met wonderful people that I want in my life for the rest of my life. And that just, it's the community has been so supportive that I want to continue.
So I think for me, I can summarize everything, why I did healthcare and nursing and being a nurse practitioner and common sense and veteran work, and it's in a quote by Hunter Patch Adams. Do you know who Patch Adams is? Seen the movie? Robin Williams did a good job.
Yeah.
Probably one of my favorite quotes. When you treat a disease, you win and you lose. But when you treat a person, you always win. That's why I chose this practice. That's why I chose individualized, personalized healthcare. That's why I chose common sense as an option for people, because I am serving the population I'm serving. Some of them do not want medications, and I need it to be better for them.
So that's a mic drop for me, man.
Or tissue box.
That is a tissue box. But like, when you treat a disease, you win, you lose. But when you treat a person, you always win.
You always win.
Let's end on that.
Let's end on that. We'll see you guys next week.
We love you all.
We love you all. Thank you
attention
so
to the
much, guys.
drawing.
Great episode. We'll see you next week.